let's talk about the triggers.
Yeah.
You mentioned triggers. What would the triggers be?
Okay, now we talk about the triggers. I guess everyone familiar about smoking.
Yes.
Yeah.
It's a nationwide pastime, so-called.
It's nationwide issues.
Yeah.
About smoking. So smoking, the triggers, number 1 is smoking, number 2 is smoking, number 3 is smoking for me. But the rest, do you have other triggers also? If you have exposures to chemicals, such as if you are working in the environment that full with chemicals. If you are working in an environment in a factory where you are exposed, we don't use your PPE in terms of covering your nose or whatever. In a chronic exposure, in a prolonged exposure, it will damage your lungs. In a patient or a layman or a citizen who has exposure to a secondary smoker, that's the main issue. You think you are safe, but in the meantime, your household, at the meantime, your spouse smoke. It gives you bad kind of exposure to the smoke itself. I remember previously I spoke to someone. Basically, they said, "Oh, I'm just a secondary smoker." So he said or she said that I bet the effect is more towards the primary smoker, but you are wrong actually. If let's say you are a secondary smoker. Let's say you are a child.
Yes.
Let's say you have a child.
Yeah.
Let's say, I'm not saying that you are a smoker. Let's say if you smoke, you expose your child to the smoke itself since the beginning. And as he grow old or she grow old, she starts to smoke at the age of 20. While you yourself smoke at the age of 20. So the exposure towards you is starts the age of 20 until whenever that you stop. And remember, you have your filter in your cigarette.
Yes.
But for your children, if let's say you smoke since the beginning of his or her age, let's say since he was born, you've been exposing him or her,
to
your
cigarette.
own child, towards the smoke. So the accumulative effect is terrible. Yeah. So that's why I said number 1 is smoking, number 2 is smoking, number 3 is still smoking. Then number 4 is, as I said, chemical exposure. If you have multiple admissions to the hospital because of infection of the lungs, also can cause coronary obstructive pulmonary disease. And of course, genetic wise, also certain disease such as alpha-1 antitrypsin can cause coronary obstructive pulmonary disease too.
But in terms of environment, lifestyle, it's smoking. That is the main.
Lifestyle is smoking. Number 2 is your working environment. So we do have. I think if we compare ourselves, if we compare our citizens, if we compare our community with the Western countries, we can see whenever that the person who work in that kind of industry in Western countries, how they wear their attire is complete with all those PPEs. Personal protection equipment.
Yes.
For us, it's okay. It's just for a little while. It's okay. It's just for the day. It's actually the cumulative effect. You don't know now because you're young.
Yes.
By the age of when you retired, the thing will start to come in.
Yep.
Yeah.
And that's when your insurance starts getting burned.
yeah. And that's the time we said, oh, this is all because of my work. It's not because of your work, because of yourself not using it.
Yes, absolutely. Like, for instance, I recently read a very interesting article talking about evaporative components of paint. Just painting your house itself without PPE can cause issues to your lungs.
It can cause the issues to your lungs because you've been inhaling those substances.
Yes,
slowly.
absolutely.
Yeah.
And remember, your lungs, you only got 2 of them and you need them for the rest of your life.
Yeah.
Right. So, now let's talk about the common symptoms of COPD, doctor. What are some of the common symptoms that people should be aware of?
Okay. COPD symptoms is actually kind of overlap with other symptoms. Patients usually come to you with shortness of breath. Doctors, I came to see you because I think that I feel breathless. Somehow other patients will come in, doctor, I keep on coughing. The cough with increasing nature in terms of your sputum, your phlegm coming out tremendously. Other than that, of course, you feel like chest tightness, wheezing sound. Those are the symptoms that usually patients or a person who will come to you and see you. But do remember, those symptoms overlap with other things. Those symptoms overlap with your asthma, your bronchial asthma. Those symptoms overlap with your heart issues. So that's the important thing, is that how we really want to know whether this is the disease that we are talking about. That's the thing that we should know. People usually who come in the age of 40, 50, 60s come, I do have this shortness of breath, I do have this cough, prolonged cough. Those things that we need to investigate.
Yes, absolutely. Because the symptoms, as you said, they might be indicative of something else.
Yeah.
But then what we are looking for is the fact that it's COPD. All right. And the next question would be, what are the main risk factors? But I think you already elaborated on that quite well earlier. Smoking being the major concern right here.
Is the main major concern.
All right. Doctor, in that case, what we're going to do is we're going to take a short break. Once we come back, we'll talk about diagnosis and as well as testing for COPD right here on TRAXX. And also, if you guys do have any questions, you can send it to our TikTok page. We would try to answer it, but please keep it pertinent to the interview today. Right, so we're currently talking to Dr. Mohammad Zafran Zainal Abidin. We're talking about COPD, a guide for you. Right now, let's get some music going, and we will be back shortly. Welcome back to TRAXX FM, and you are currently on Momentum with me, Health on TRAXX, coming away today with our guest in the studio, Dr. Mohammad Zafran Zainal Abidin, talking about chronic obstructive pulmonary disease. This is something that smokers need to be very well aware of. Doctor, how is COPD diagnosed, and what are some of the key tests involved?
Okay, let us recap back to whoever listeners that didn't listen
Earlier.
So, as we said, chronic obstructive pulmonary disease is mainly caused by the smoking, right? Let us see back in terms of our lung itself. We only have two lungs, as you said.
Yeah.
A set of lungs. It's not two lungs.
A set of lungs.
Yeah, a pair of lungs.
Yeah.
Lungs usually matured in our body as we grow old. It's about 25 years old to 30 years old. It's fully matured. And it starts to decrease the function by the age of about 35 to 40.
Oh, no.
Okay. So, just imagine if you put insults to the lung, as it grow older, as the function grow lower, the insults towards the lung cause it more worse, worsen the lung condition. So that's why basically all the COPD patients, chronic obstructive pulmonary disease, don't feel the heat yet until they reach certain age. That's why when you said if you are younger, you are at the age of 20, you are at the age of 30, you are at the age of 40. Oh, I already smoked for the past 20 to 30 years. I didn't feel anything. Because your lungs still okay.
Yeah.
Our body is just like a car. As the car grow old, the problem come one by one towards it.
Yeah, older cars need more maintenance.
Yes, and it's more expensive.
Yes, true.
But thank God car got spare parts.
Yeah, we don't.
We don't. Yeah. So how do you want to diagnose COPD? As a medical practitioner, as a health practitioner, number one is your history. Number two is your history, and of course, history is the most important thing. Because as I said before you played the music just now, the symptoms overlap from asthma, from the lung, the heart condition,
bronchitis.
So by knowing your history, by knowing your disease history, as in if you are a smoker, how long have you smoked? What's your working environment? Is there any hospital admission previously?
All right.
It will give a lead to us whether this is a chronic obstructive pulmonary disease or not. There's a lot of misconceptions towards COPD. A lot of our laymen, our public keep on saying that, I do have asthma. I do have asthma. I do have asthma. Yes, asthma and COPD might be overlap, but for a smoker, most of the smokers, usually it is a chronic obstructive pulmonary disease, right? One thing about asthma and COPD, asthma usually start from young.
Yeah.
COPD start
after you start smoking.
Old. Then from there, what we usually do, if we got the history of your smoking history, of your working habit in your working industry, or your past medical history, we will do some investigations, such as chest X-rays. From the chest X-ray, we can see some pertinence points towards COPD, and of course, the main thing that we do usually we'll do a blow test. That blow test, what we call as in spirometry, that spirometry will determine whether you are having obstructive disease or not. Your airway is obstruct or not.
Yes, and that is the machine where there's like 3 balls in it.
No, that is a different thing.
Oh, that's a different thing.
That's a different
Okay, okay.
The 3 balls is incentive spirometry. The 3 balls is basically for your lungs to exercise.
Oh, I didn't know that. Okay.
The one that we have in terms of the blowing test is connected to a computer. Then you need to blow. You need to blow as hard as you can to see, and then we measure your lung capacity, all those things, and your your blowing measurement, all those things. And then in chronic obstructive pulmonary disease, is actually the blowing. The calculation will come out as in obstructive. Okay, but do remember, asthma also is an obstructive disease. So we need to further up the test to differentiate between asthma and COPD. Yeah.
All right. So there are already diagnostics that you can do, and the key tests, as you said. And of course, let's talk about the treatment options, because this is something that's more important, because I think people, once they hear like, hey, I'm still young but I smoke a pack a day, so when I'm after 40, what's going to happen to me? You want to know what's the treatment options available for managing COPD, and how can patients improve their quality of life?
If a patient come to me to say that, oh, I'm still young, I'm still smoking, what is the treatment for me for my COPD later on? My first answer to them is stop smoking.
True.
Okay.
Remove the disease-causing material.
Remove the whatever that insult your lungs.
Yeah,
Number
the trigger.
one, the triggers. Yeah, that's the number one. So when we talk about let's just talk about the treatments. When we talk about treatment, in every diseases we have guidelines, right? So for COPD, usually we do follow a guidelines, what we call GOAL guidelines, where this is worldwide guidelines for our obstructive pulmonary diseases, and it keep on updating every year. We have updated last year, they updated again this year in terms of the guidelines, in terms of the treatment. You can divide it into medications, as in what we call pharmacological, yeah, and you can the other segment will be non-pharmacological, yeah. In terms of pharmacological, in terms of the treatment, we do have those bronchodilators, the inhalers.
Like asthma inhalers.
Like the asthma inhalers, but it's not the same component.
It's different component.
It's a
completely.
different component. Those inhalers, and we got 2 types of inhalers. Now, number 1 is bronchodilators. Number 2 is basically more towards inhaled corticosteroids. And who should use these bronchodilators and inhaled corticosteroids? It depends on the patient itself. We will categorize the patients. We will reassess the patient by knowing their symptoms. We will reassess the patient by knowing their shortness of breath skills and how many times they admit to the hospitals. From those history, we will initiate the treatment based on that. Okay, that's number 1 in terms of the inhalations or treatment that you can be used in terms of medications. For non-pharmacological treatment, as I said, stop smoking. There's no point for me or for whoever start any treatment if you keep on smoking.
True.
As in, I give you medication, but you keep on damaging your lungs. You keep on throwing your money buying all the medications. Yeah. But at the same time, you're throwing your money buying the cigarettes too.
Absolutely.
There's no point. Might as well just give it to your wife rather than you give it to the cigarettes or to the doctors, to the cigarettes manufacturing. Other than that, it's basically in terms of your exercise, your healthy lifestyle. That's number 2. The other one. And of course, to patients who already have chronic obstructive pulmonary diseases, you should enroll yourself into pulmonary rehab, where those rehab physicians, those physiotherapists will teach you how to do exercise in terms of your lungs. Yeah. In patient who has a very bad or severe chronic obstructive pulmonary diseases, usually we call as in GOAL E. Again, as I told you just now, basically we have GOAL criteria, GOAL guideline. So GOAL also divided into A, B, and E. GOAL E is the most severe one. Usually, certain patient who is in worse situation in GOAL E criteria, certain patient require even oxygen at home. So you need to go anywhere with the oxygen. Do you want yourself to be like that?
Carry a tank wherever you need to go.
Yeah, you cannot travel so far because you need to attach yourself to the oxygen. Is that the life that you want later on if you keep on smoking?
There is no quality of life.
There is no quality of life. It's correct. There is no quality of life. The main point of treating a patient is for us is basically to maintain the quality of life, to reduce the symptoms and to slow down the progression. As we said earlier, the disease is progressively in nature. Yeah.
So it gets worse and worse and worse until you hit goal E if there's no medication or any intervention
We
involved.
can still give the inhalers, but the lungs, whatever damage has already been done.
It's done.
So you cannot reverse that. Whatever that we do is try to maintain whatever left.
Yes, there will be a certain percentage left, and you'll have to live off that.
At certain point, you need to kind of survive with the oxygen next to you. Although you have the oxygen surrounding you, you still need to have those
Direct inhalers.
direct inhalations in terms of the oxygens. That's the worst case scenario, where you keep on having a difficulty in breathing. You keep on gasping for air because of your own faults.
Understood. That is something that we have to think about, especially for those who us who might be smoking. It's a real concern.
It's real concern. It's not about that also. It also give the burdens towards our health system.
Because, and also for caregivers
Caregivers.
at home, who's going to take care of you?
Yeah, like let's say both of us, basically you have an aging parents, I bet everyone who is in our age will have those aging parents. Let's say if their parents have these issues, who's going to take care of them?
Yes.
You need to fork out some money to put someone to take care of them.
Or you need to even stay away from your job,
Yeah,
and
those things.
that will put a dent in your career as well. So it's going to be a problem. It is a compounding problem to everyone around you. And are there any new technologies, doctor, that is coming out that is targeted towards COPD?
In terms of new technologies, we do have in terms of lung volume reductions, all those things. But it's not all patients suitable for it. We really need to thoroughly examine and thoroughly kind of categorize the patient who is supposed to get all that kind of treatment. And that kind of treatment is not really, it's not cheap. It's not cheap in current era. And of course, there's a criteria who is eligible and who is not eligible. Yeah, the mainstay in terms of the treatment, what we have now in terms of more towards inhalers and the oxygen therapies.
It's just to manage.
It's just to maintain and slow down the progression, of course, to reduce the symptoms.
All right, understood, doctor. And I see there is something regarding vaccination required in COPD. Could you explain that to us?
Whoever has lung issues, whoever have lung disease, basically we will advise you towards vaccination. Why? Vaccinations will reduce the risk for you to get infection. In normal persons, assume you are normal.
I am normal.
Okay. Assume your lungs is normal.
Yeah.
When you got a lung infection, the worst, basically you'll get admitted to the hospital and get treatment.
Yes.
And by God's sake, basically you'll be treated well, inshallah. But then it's just that just imagine whoever has this goal D, goal E in terms of goal E, COPD, which is in severe diseases, got a lung infection. What will happen to them? Number one, the capacity is already low. Number two, the lung itself is already troublesome. Then you got on top of it infection. The scenario will become worse towards this kind of patient. The mortality towards them is higher compared to the rest. So what do the vaccine did to them is by reducing the risk of getting infection. So in COPD patients, in Malaysia, usually what we practice, we'll give in terms of your influenza vaccine and pneumococcal vaccine. Of course, in the guideline, we can say that we also advise towards pertussis, all those things. But in general, we give these two vaccinations, as in your influenza and pneumococcal vaccination. We passed already the era of COVID. During that time, during the COVID era, we advise all the patients who has this kind of disease, COPD patients or any lung disease, to underwent these vaccinations towards COVID. So we passed that era. As for now, we do advise the patients to get a pneumococcal vaccine and influenza vaccine. Remember, it's not a shot throughout your life. It's just that influenza, you need to renew it every yearly basis. Yeah. And pneumococcal, usually they have a kind of schedules. Two types of pneumococcal that usually I practice now. One is once in a lifetime. The second one is about 5 yearly. So those things you need to update yourself, because preventing is always better than cure.
It always
It's
is.
always better than cure. Prevention. Yeah. So those things is something that you really need to keep aware.
Mm-hmm.
Certain patient or certain public can kind of take a laid back approach.
Mhm.
It's okay, it's just a cough, it's okay,
Yeah.
it's shortness of breath, it's okay, it's just a fever. And the end of the day, the burden is not only on you, it's on towards your family itself.
Yes. So smoking. Now we know what can happen at the end of your smoking era.
Yeah.
Right, the COPD. That is extremely scary to hear because it's such a big problem because puts a lot of pressure on a lot of different aspects on people, on the economy, on the health sector, and so much more. Right, Doctor, we are actually at the end of our interview for today. But before we end, is there anything else that you would like to add for our listeners today?
At the end of the day, I just wanted to let the listeners hear that yes, your body is your own responsible.
Mm-hmm.
The responsibility on you. The God create your body for yourself.
Mm-hmm.
You need to take responsibility for it.
Mm-hmm.
But do remember, if you don't take responsibility towards yourself when you got ill, it's not only you're going to burden. It's across the level. It's across the tiers.
Mm-hmm.
From your family, your friends, the government, the financial burdens, everything.
Mm-hmm.
So the first steps towards avoiding chronic obstructive pulmonary disease, as in we are talking about COPD now, stop smoking. Just imagine, if I'm not mistaken, smoking wise is about one pack of cigarettes is about 20 ringgit, right? It's about that. I'm not really sure. It's about that.
I think it should be around there. Yeah.
Oh, it's higher now. I'm not really sure.
Mhm.
Certain patients smoke even 2 packs or 3 packs per day. It's about,
Wow.
let's say 60 ringgit per day. That 60 ringgit, if you calculate it into a month,
1,800 ringgit.
1,800 ringgit. There's a lot of things that you can do with 1,800 ringgit.
Yeah, you can go traveling if you save for 10 months.
Yes, every month you can go traveling.
Every month can go traveling. I like this, Doctor. Very nice. Right, so Doctor, thank you so much
No problem.
for giving us the time today to talk about COPD, and I believe there is more to be discussed in regards to all of this in the future. We hope to have you again.
Sure.
And of course, with that, I'd just like to say a big thank you to you
Thank
as
you
well
to
as
you
your
too.
team for being here today.
No problem.
And we will see you again.
Thank you. Thank you.
All right, so we spoke to Dr. Mohammad Zafran Zainal Abidin, consultant in respiratory and internal medicine, UITM Private Specialist Center, UPSC. We spoke about COPD 101, a guide for you. And I was just on TikTok and I saw people was commenting on our conversation earlier during the break. That was only during the break. We are talking about COPD today, okay? Well, anyways, more music coming away. I'll be back in the next hour. Don't go anywhere.